Greetings, everybody, and welcome to Mental Health Bytes, a show where we break down big mental health topics into bite-sized, actionable conversations. I'm your host, Brandon Jones, Executive Director at Minnesota Association for Children's Mental Health. And on today's episode, we're going to look at a powerful yet necessary topic, which is suicide. September is Suicide Prevention Month. This isn't just about statistics or campaigns, it's about people. People we know, love, and maybe even ourselves. It's about raising awareness, yes, but more than that, it's about fostering hope, breaking silence, and taking action that saves lives. So in this episode, we will cover three things: key warning signs of suicidal ideation, especially in young people, supportive language to use when checking in with someone, and reliable resources for you to turn to if you find yourself in a crisis. Let's dive on in, and as always, take what resonates, share what helps, and be gentle with yourself along the way. Let's take a look at warning signs. How do we recognize them? Here's something that often gets missed. Suicide doesn't always look the way we expect it to. Sometimes it's not a dramatic cry for help. It's subtle, quiet, hidden in plain sight. Here are a few common warning signs that young people go through, or really anyone, but we're focusing on the young people. First, expressing hopelessness or saying things like, "What's the point?" or "I don't see things ever getting any better." 2. Complaints about emotional or physical pain. This could be frequent headaches, stomach aches, or fatigue that seems to have no clear cause. 3. Withdrawal from friends, family, and activities that people once loved. 4. Noticeable change in sleep. Either they're sleeping way too much or they're not hardly getting any sleep at all. Number 5, agitation, irritability, or even unexpected anger. This could look like, snapping at people. People are just being very restless. People shutting down. Agitation, that irritability, and that anger shows up a lot. The next one, talking or posting about death, dying, or saying things like, "I wish I could just disappear." These are all warning signs to pay attention to in a young person's lives, both online and offline. What are they signaling to the folks around them? Here's what's important to remember, even with all these different warning signs. No sign is too small. If your gut says something is off, trust your gut. Sometimes it's not about solving problems in the moment, it's about showing up so that they don't feel alone. Next, starting the conversation. So let's talk about what many people fear. What do I even say if I think someone is suicidal? I get it. It's hard. The fear of saying something wrong, doing something wrong, can be very paralyzing. But silence is far more dangerous. Here are a few things to remember. You don't need to be perfect with your words, but you do need to be present with your actions. It's very important that you stay present with the people you're trying to engage with, especially the young people. Here are a few ways to start a conversation. You could say, "Hey, how have you been feeling lately?" Or, "I've noticed you've seemed down. Do you want to talk about it?" Or, "I care about you. Are you feeling safe right now?" Or, you can even say this: "Have you had thoughts of suicide?" Not an easy question to ask someone, not an easy question to even think about, but it may be that necessary question to ask to really get the help that the young person needs. The last one was very hard, but research shows that asking directly does not increase the risk. In fact, it often provides relief. It shows that a person that, that there's not a burden to how they're feeling, and that someone does see them and care about how they feel and what's going on. So if there is a yes to any of those questions, don't panic. Try your best to stay calm. Let them talk and share their perspective, and then give some reassurance that they are not alone and that you are there to help them get connected to the supports that they need. And if they say no, but your concern remains, it's still worth following up in the next few days to make sure that they are, still alive, safe, comfortable, whatever the case may be. And then always feel like providing a level of connection can potentially save their life or get them the intervention that they need. So don't give up because they say no. Keep an eye on them, but don't be pushy. Don't be pushy. All right, let's give a few resources. So let's talk about where to turn if someone, especially a young person, is in crisis. Here are some trusted options. The first one, I can't restate this enough, is 988. 988 is the suicide and crisis line. This line can be called or text at any time. It's 24/7. It's always available. It's free and it's confidential. That number is 988. We should think of this as the mental health crisis line. This is your go-to for assistance, 988. You can also text the word home to the crisis text line. The crisis text line number is 741741. 741741. This service connects you to trained crisis counselors via text message. And, it helps young people typically feel safe when they can talk to somebody directly. That's, again, text the word home to 741741. Always try and attempt to connect with your local mental health services. Some provide walk-in crisis centers. There are mobile response teams in some areas. I know that other areas don't have these resources, so I'm not going to name off a bunch of them. But try to figure out what you have locally if you can and get connected. And then one of the best places to connect for young people, especially right now, is at schools. School counselors and trusted adults within school buildings can be your first point of access to the help that you need. Sometimes a young person might not want to reach out to a hotline, but they might want to talk to a teacher, a coach, a behavioral dean, someone, a social worker, someone in that school, a lunch person, someone in that school that they can reach out to. So if you're that adult, take them serious and get the help that they may need. Get them connected as quickly as possible. So one more reminder, you don't have to wait for a full-blown crisis to seek help. Prevention starts early. So when we check in, listen deeply, and we create safe spaces for hard emotions, young people have a better opportunity to address their issues before they become to the level of suicide. So don't be afraid to take action when you can and as quickly as possible. So here's my compassionate call for action for you, right? It's my compassionate call for action. So where do you want to go from here? We live in a time where young people are overstimulated, overwhelmed, and often overlooked. Many are carrying silent burdens of fear, trauma, identity struggles, loneliness, pressures to be perfect, and no safe place to lay them down. This September, I'm asking you to be a part of a solution. Check in with someone you care about. Even if they seem fine, check in with that young person. Normalize emotional conversations in your home, in your community. Talk about mental health in a way that you would talk about your physical health. Educate yourself on the signs. We gave you some here. There's more out there. Check them out. Go ahead and Google it. Share what you've learned with others. Challenge stigma. When someone says, that they're just being dramatic, help them understand what pain might be hiding underneath. And then finally, take care of yourself too. You can't pour from an empty cup. Again, suicide prevention doesn't belong to one expert. It belongs to all of us. Each conversation we have, each check-in we offer, each story that we make space for is a thread into the safety net that keeps someone going another day. You don't have to be perfect. You just have to be present. Thank you for listening to this episode of Mental Health Bytes. If this resonates with you, share it. Talk about it. Bring it into your family, your school, your workplace, and your community. Let's continue the conversation. We'll see you next time here on Mental Health Bytes. Take care.